Hi everyone, I'm Cassie Goodman. I'm the Early Detection Programs Manager at Nevada Cancer Coalition, and I'm here today with Amy Thompson, who is our Cancer Survivorships Programs Manager at Nevada Cancer Coalition. And Amy has worked for almost 6 years as a breast nurse navigator, and she's now working with Nevada Cancer Coalition as a patient navigator with the new Thrive NV program. So thanks for coming on, Amy.
Well, thanks for asking me to be here, Cassie. It's nice.
So Paint Nevada Pink is a campaign to promote early detection for breast cancer, and we're really pushing annual screening mammograms for women of average risk starting at age 40. So for you as a navigator, why are you excited for this campaign?
Well, I'm really excited to support this Paint Nevada Pink campaign because it is so important to promote clear messaging that mammograms save lives. And screening recommendations can be really confusing, and they shouldn't be. And as part of the healthcare and public health community, I feel it's our responsibility to come together and remove some of that confusion, and that's what we're trying to do here with Paint Nevada Pink. So Paint Nevada Pink, again, is about promoting the unified screening recommendations that women starting at the age of 40 should be getting annual mammograms as long as they're average risk. Coming together as a state to promote this message is really going to hopefully be the critical step to empower each other and advocate across our state that early detection saves lives, and that's what we're trying to do.
Great. So that's really it's so important for women to get regular screening mammograms. As a navigator, what barriers have you seen that prevent women from doing this?
Yes, well, there are several. I'll just touch on some of the biggest ones, if you will. And one of them, like I mentioned already, is the confusion with some of the recommendations that have come out. Women have gotten really confused about how often they should get a mammogram, when they should start, when they should stop. And that's really another reason why Paint Nevada Pink is so important, because again, we're trying to drive home that point of getting your annual screening mammograms starting at the age of 40 for average risk women, to remove that barrier of confusion so we all are on the same page. Another really obvious barrier that we've all experienced right now is COVID-19. So a lot of people's annual screenings have kind of been pushed aside for several months, and understandably that had to happen for a while. But now we're really here to try to promote that message again of getting back out there, getting back on track with your screening mammograms. We really encourage you to reach out to the facility that you get your mammograms at and ask them what their safety precautions are, what policies they've put in place to make you feel safer to go in and get those mammograms again. So a really huge point we want to make sure to make. And then just a couple more very large barriers, financial. So screening mammograms are covered by insurance, but unfortunately, not all of it is covered, so there can still be some out-of-pocket expenses, which can be difficult to cover. And then again, COVID-19 has changed the landscape. Some people have lost their jobs, which means they've lost insurance, which means now you might be worried about where to go get a mammogram and how to even get one. So a lot of that has really been impacted, but there are options, so we want you to know that. And then another important barrier that can happen too for people, you may have struggles with getting time off of work, or if you're a primary caregiver of someone in the home, you may not feel that you have the time to take time away from those duties to get your screening mammograms. So those are some very big barriers. There are several more, but I think we get the idea. There's a lot to deal with there.
Yeah, hit the highlights. So what are some ways that women can work around these barriers?
Right, well, I really think that as for most things, education is key. So again, if you work at a company and you're not sure what their policies are for getting time off to get your screening mammogram, we really encourage you to talk to your employer about that. If they don't have policies in place and they're interested in starting something, reach out to us at NCC. Cassie has been instrumental in starting some policies that we have put in place at NCC, and she's really interested in helping other employers to do the same. Again, if they're creating those policies to create space and time for employees to get screened, that just removes one of those huge barriers. So that would be a recommendation. We would want you, again, to reach out to your employer and find out what's in place for you. And then if anything that we've talked about today, if you feel that you can identify with any of these barriers and you want some more information, maybe you want some more education about why you need a mammogram, anything at all, really, talking about options to overcome financial concerns, anything like that, you can reach out to us as patient navigators at Nevada Cancer Coalition. You're looking at both of us. Cassie's one and I'm the other. So we are really here to help the community. And if we can help dispel some of those barriers and get you to the resources you need so that you can get your screening mammogram, that's what we're here to do.
Perfect. Thank you. Yes, and you all can reach out to us via this Facebook page that you're on. The Nevada Cancer Coalition Facebook page and our website can give you more information. So Amy, do you have any final thoughts for the community tuning in today?
Yeah, just really take this opportunity to get involved. I mean, come join us, be part of Paint Nevada Pink. It's an initiative for all of us across Nevada. So we want you to share the importance of getting annual mammograms starting at age of 40, empower the women around you to do that, be an advocate for yourself, and just really spreading that message that mammograms save lives.
Perfect. Thank you for joining us, Amy. And you all can get involved with this movement again via this Facebook page that you're on, or you can also go to paintnevadapink.com for more information. And thank you, and everybody have a great day.
Thank you.